Hey, my little monsters. How's it going? This is Mr. Miller. We're on like day 14 of quarantine, and I'm struggling a little bit. So, actually, kind of looking forward to making these lessons and interacting with you on Wednesday. I hope you're all still continuing to take care of yourself, um, taking space when you need it, interacting with people, getting outside if you're allowed. I want to respect your time again with this lesson. I'm going to only make it 15 minutes, so I'm going to put timer up. Settle in for 15 minutes. Try not to go over this time. This lesson is going to correspond with this worksheet. I don't know, right here. So hopefully that's coming up for you. Drug classifications part 2. You did part 1 last week where you researched a drug classification. Today I'm just going to go over the different types of drug classifications. So most of it should be new, except for maybe the group that you researched last time. So just follow along with this worksheet and the presentation. I have the instructions here, the objectives. You're going to journal, take notes, and then come up with any questions you might have for our lecture. Okay. So here's our presentation. Again, if you can't find the worksheet, you can actually click this link and it'll come up. Okay, so don't hesitate to do that. I want you to journal first today. It is a Tuesday, so please take the time. I think we're on the 8th. Take 10 minutes out of your day. Set your timer, put away all your technology except for maybe some music and just write. So you can do it in the worksheet that I gave you digitally, but if you prefer to do it on paper, that's totally okay as well. I trust that you'll do it. And the prompt, if you want, write out how you've been feeling and what you've been doing. I know it kind of feels good to talk about that. I know I like to talk about it. Then there are times as well where I don't really like to talk about it. So if that doesn't feel good, write about something that makes you happy, or write about your best friend or a role model you have and what you like about them. Okay? So if you're hearing this, pause the tape and do your journal entry. Okay, we're back on our journal entry. So today our goal is just to talk about the different classifications of drugs. And like I said in your worksheet last week, we are going to go over 5 of the main categories, but these are not all of the categories, right? Like we're not going to get into anabolic steroids or different types of medicines or things like that. We're going over just 5 major categories. And I mentioned this chart last week when we talked about mixing substances. If you look, it lists a drug on the top and a drug on the side. So this is like basically a chart of saying how risky is it if you mix these 2 drugs. So if you look at the chart on the bottom, oh wait, where is it? There's a key. Here you go. Low risk and synergy, low risk and no synergy, low risk, caution, da da. So basically it's saying how risky is it for you to mix these different drugs? And I know there are always lots of questions. So for example, greens are typically the psychedelics up here. Let me see. Looks like red is stimulants / psychedelics. Blues are depressants. But let's say you mixed alcohol with mushrooms. You would be in this dark blue one right here, to be low risk and decrease. However, if you mix alcohol, which is a depressant, and ketamine, which is another depressant, that's super dangerous, right? And again, this is not saying that it's always okay to mix these things. You always have to be cautious whenever you're mixing anything. We're just giving you a general guide. So feel free to explore that on the document. There's a link right here. So our drug classifications are stimulants, psychedelics, depressants, opioids, and cannabinoids, which we'll just call cannabinoids marijuana. In your little note sheet, please take notes on whatever comes up, write it down. Write down any questions that come up so we can address them in our discussion. But you don't have to take notes on the drug you researched last week, right? That doesn't make sense. You already researched it. You already know about it. If something comes up that we're talking about that maybe is interesting or a question comes up, definitely jot it down so we can talk about it. But otherwise, don't feel like you need to. And again, you understanding every nuance of every drug or every name or the name of every drug is not necessarily that important, right? We group them into the categories because the categories tend to have a lot of similarities. So, you know, like I think I used the example on the worksheet last week, like cocaine, caffeine, Adderall are all stimulants, right? So if you know that, you know they share a lot of commonalities, whether they're illegal or legal. So we're going to start with stimulants first. And just think of the word stimulate, right? So stimulants are things that speed up your central nervous system, which is your body's functioning, right? So they can make you more awake. A lot of times they suppress your appetite as well. People use them for mood enhancers, things like that. So everything is speeded up. So like your breathing, your heart rate, your pupils dilate, or should I say constrict? Sorry. Um, while this could be a good thing, and a lot of people like the way these things make people feel, they can also make people feel anxious, irritable, jittery, or impair their judgment if they take too much, right? So we have some examples here towards the back. Nicotine is an example, right? I think that came up in one of our group discussions last week. Nicotine is a stimulant. Caffeine is a stimulant. These are both legal, right? However, we know that crack, cocaine, amphetamines, such as Adderall and Vyvanse, which are prescribed for people with ADD, ADHD, crystal meth, Ritalin, all of these are different types of stimulants, right? Some are legal, some are not, some are prescribed, some are not. But essentially, if you're taking these, usually you want to feel more alert, more awake, and that comes with certain consequences, right? It can also lead to difficulty sleeping or dehydration. If you're prescribed them, which they are, it's definitely important to take them exactly as the doctor prescribes them, right? So remember our dose and dosage. Dose is how much, dosage is how often you take it. And it can be used in any form. So if you had crack, you can smoke crack, you can snort crack, you could ingest crack, right? The way you take it is going to affect how fast it hits you, and also how long it stays in your system as well. So think of stimulants, stimulate. Depressants will do the opposite of stimulants, right? So stimulants speed up your central nervous systems and your body's processes. Depressants are going to slow things down. So a lot of times people take these and they need to feel calm or relaxed or sleepy, right? So sleeping pills, a lot of them will actually be grouped into this category. So slowing your brain function down, your heart rate, your breathing, your reaction time, and things like that. So alcohol is a depressant. This is one of the big misconceptions that alcohol is a stimulant because people you see who maybe drink, they get a little hyper or rambunctious, when in reality, alcohol is actually slowing your body's processes and systems down, right? Which is why when you drink a ton of it, your body starts to shut down to keep you from drinking. That hyperness you see is usually because people feel a little more relaxed and easygoing and their inhibitions are a little bit gone. Tranquilizers, Valium, Xanax, and different sleeping pills are also depressants. GHB and Rohypnol are also depressants, which are date rape drugs. So they are placed typically into drinks or given to people, and then they're more easy to take advantage of. GHB is also a party drug as well. Same thing, similar to stimulants. You want to use these exactly as they're prescribed by the doctor, if they're prescribed, right? Because we know people take certain depressants for feelings of anxiousness or anxiety or worry or things like that. So they are super beneficial. We know alcohol is legal in America for people over 21, for people in Europe and other countries, sometimes it's over 18. Sleeping pills help people sleep better. And again, just like anything else, it can be taken in any format. Knowing your dose and dosage is super important. Moderation, especially for alcohol, starting low, going slow, making sure you're not taking a lot right in the beginning, knowing what type of alcohol you're drinking if you are drinking. So in our next lesson, we're going to talk about the difference between like a liquor and a spirit versus a wine or a beer and how that affects your body. The next one, a pretty cool group, is called the psychedelics. So when you think of psych, just think of your mind, right? So these are the drugs that kind of distort your reality, and they affect kind of your senses. The interesting part about psychedelics is that they're going to affect each person differently, and they're going to affect each person differently every time they take it, right? So you may have what we call a good trip one time. You might take the same drug a different day, different experience, in a different mood, and have a totally different trip. which is one of the interesting things about psychedelics. So if you've heard of these, LSD is a psychedelic, which is also known as acid. It's a little tab that's placed on your tongue and it dissolves. Psilocybin mushrooms, also known as magic mushrooms. Peyote is a cactus, ayahuasca. And then we have MDMA, which is ecstasy. So a lot of these come from natural things, like mushrooms grow from the ground. Peyote is a cactus. Ayahuasca is some sort of, I think, like soup or drink. So this kind of breaks the notion that everything that is natural is safe, right? Because these can be safe if you're using them correctly and you know what you're taking. They also can lead to bad trips, which we want to avoid. In the past, psychedelics are definitely used to treat mental illnesses, and there's actually a growing amount of research and studies that are coming to light now where doctors are starting to examine this again. People take psychedelics to kind of leave reality and maybe feel a certain way, maybe feel relaxed, maybe feel a little bit of energy, feel a little tingly or some sensation, see different colors and things like that. But one of the biggest things is the set and setting that you take a psychedelic, right? So if you recall from our last lesson, set is your mindset. So if you're feeling good, chances are hopefully you'll feel better as you take the drug, right? If you're feeling bad, you're going to be more likely to have a bad trip. So you really have to be mindful of how you're feeling when you take this drug, just with any other drug. But these are much more in tune with how you're feeling. And also your setting. If you feel comfortable with the people you're with, the location you're in, you're probably also going to have a better experience than if you're nervous, anxious, with people you don't know, you're scared, etc. Most of these are taken orally. I don't know too many that are injected. Um, oops, sorry. And it's just these are not, as of now, I don't think any of them are prescribed by a doctor. So most of them are not legal. But again, like I said, they are being researched. MDMA, just to clarify, ecstasy is like a party drug as well. Opioids. When you think of opioids, I want you to think of pain relief, right? This is one of the groups of drugs that is continually the most abused for a variety of reasons. And again, comes from a natural product, the poppy plant. But now it has a lot of synthetic versions, so things that are manufactured and made. So if you think of morphine, fentanyl, which we'll talk about in a couple lessons, codeine, oxycontin, Percocet, Vicodin, these are all things that are used to decrease pain, right? So they have very similar characteristics to depressants because a lot of times they're slowing your body system down, but their main goal is to manage pain. So they basically imitate your body's normal response to pain and kind of block that pain, right? So the pain's still there, it's just kind of blocking it. The thing that research is finding with opioids is that they're super addictive, right? Especially because a lot of these are very legal. Heroin used to be legal. It used to be used in hospitals. Now it's super illegal. But they are very, very addictive, which makes that once you start, you really want to make sure you're following them as prescribed and not taking more than you need because there's a strong chance that could lead to addiction. They can be taken in any format. So orally is typically the pills. With heroin or with anything, you could smoke them, you can inject it. People crush pills up and snort them to hit their body faster. New York actually has a high level of opioid use compared to the rest of the country. Typically, I have a presenter come in who teaches us about, I think it's coming up here, naloxone, which is a life-saving drug that if you overdose on opioids can actually reverse the overdose. So essentially what it is, it's a spray that is sprayed up your nose to somebody having an overdose. And what it does is it kind of kicks those receptors out of your brain and lets you come out of that overdose, right? If it's not an opioid overdose, it's not going to cause you any harm. So very, very cool life-saving medicine that has come out. And we're really trying to prevent overdoses. But we have large populations of people who are now super addicted, especially the elderly. We know youth are experimenting with this as well. But again, opioids, think of pain relief, think of addiction. Oh, 15 minutes is up. Got one more group. Hang on. Oh my God, my roommate's screaming about some TV show. Marijuana or cannabinoids is the last group we're going to talk about. THC is the main ingredient that people talk about that gets them high. CBD is the one that helps them to feel relaxed. So a lot of times marijuana or cannabis is grouped with psychedelics because it has similar properties. People report that they feel a different way, their senses, maybe seeing some colors or things like that. But we tend to put it in its own group because it affects different receptors in the brain, right? The technical name is cannabis sativa. And again, the effects are very complex based on how the drug is taken, right? So people, like we've talked about before, will argue, oh, this is safe, it's all natural. When in reality, anything you smoke into your lungs that's not air is not really good for your body, right? Um, Marijuana that's smoked or inhaled is going to hit your body a lot faster than if you're taking an edible, right? The smoke gets absorbed right into your lungs, which gets into your bloodstream, versus if you take an edible, it takes a while to get digested. So the biggest thing that happens is people will take an edible, which essentially is marijuana baked into food, and they don't feel it right away, and they take more, which leads them to take more, and then they get more high. When in reality, when you're taking a drug or ingesting it, you just have to be patient and wait a little bit. So a lot of people argue the benefits of marijuana is that it does manage pain, it helps people relax. But again, it is a substance and it is not recommended for developing brains, right? Like our lesson we talked about, your brain's still developing until you're 25 to 28 years old. Anytime you're taking in those substances, it's not really the best for you. We can answer more questions about that. I want to put myself out there. I'm still here for you. I haven't heard from a lot of you except from our Zoom meeting last week, but please don't hesitate to reach out. I am honestly super bored. I really look forward to our calls on Wednesday. So your job for Wednesday is to have this worksheet completed and just come with any questions that you have, okay, about anything we talked about or anything that's on your mind. I'm going to ask the group some questions. I might have us do a group writing assignment or something to get us started. But I'm really excited to see you. And I can't wait to see you. Okay. Talk to you soon. Bye.